Hygienic preparation of F75 and F100 plays an important role in reducing the risk of children getting infections from made-up feeds while in hospitals or feeding centres for the treatment of severe acute malnutrition or SAM. Milk-based powders, including F75 and F100, are not sterile. Therefore, the preparation steps described in this video are designed to kill any bacteria that is in the F75 or F100 powder, and also to kill bacteria that may have contaminated the feed from sources within the hospital or SAM feeding centre. The guidance on consuming prepared F75 and F100 within 2 hours should be followed correctly. This will prevent bacteria from multiplying in the liquid feeds once it has been prepared. To prepare therapeutic milks, you will need food-grade equipment. The following items are needed. Preparation equipment: we need cans of F75 and F100 therapeutic milk, water for boiling and cleaning, a cooking pot, kettle and stove or other means to boil water, markers and labels for recording information about the feed, a thermometer for use with hot liquid, a measuring jug and measuring cups for measuring small and large amounts of water, a feeding cup, a spoon for stirring, a whisk for mixing larger amounts of milk, a clock or timer, and a disposable hand towel. The washing up equipment: we need soap for washing your hands, washing up liquid, a bowl for washing up the equipment, and a brush. It is best to prepare fresh feeds and give the feed to the children in care as soon as it has been prepared and is ready to drink. Ideally, each feed should be prepared in an individual feeding cup. This demonstration shows how to safely and hygienically prepare F75 and F100. The examples shown are how to make up 1 cup of feed of F75 and then how to make up a batch of feeds of F75. Clean and disinfect the surface where you will be preparing the feed. Wash your hands thoroughly with soap and water and then dry your hands with a clean cloth or a single-use napkin. Wash the feeding cup, utensils and food-grade thermometer in hot soapy water. All the equipment should be able to withstand hot liquids. This is how to sterilise the equipment. Fill a large pan with water and completely submerge all washed feeding and preparation equipment. Cover the pan with a lid and bring the water to a rolling boil. Leave it to boil for at least 2 minutes. Carefully remove the equipment from the pan. Use sterilised forceps or another utensil for handling the hot equipment. Dry the utensils using a clean cloth or a disposable hand towel. To prevent recontamination, it is recommended to use the sterilised items just before they are needed. If they are not used immediately, cover them and store them in a clean, dry place. Refer to the recommended protocols or the WHO feed reference chart to see how much therapeutic milk is needed. We are demonstrating how much feed to make up for a child that weighs 5 kilos on admission. Looking at this weight in the reference chart, we can see that we need 55 ml of prepared F75. Now refer to the F75 can. We can see we need 50 ml of water to make up 55 ml of F75 milk. The next step is to boil a sufficient volume of water. Make sure the water comes to a rolling boil. If you are using an automatic kettle, wait until the kettle switches itself off. Be careful when handling the hot water to avoid scalds. Once boiled, allow the water to cool slightly, but not below 70 degrees Celsius. Check the temperature of the water using a sterile thermometer. If you do not have a thermometer, ensure that you are adding the powder to the water in less than 3 to 5 minutes after the water has been boiled. Pour the appropriate amount of boiled water into a cleaned and sterilised measuring cup. To accurately measure the water, read the water at eye level. Then pour this amount of water, which is 50 ml of hot water, from the measuring cup into the clean feeding cup ready to mix with the powder. Read the label of the F75 container to see the number of scoops of powder needed for 50 ml of water. Add the exact amount of milk powder as instructed on the label. For 55 ml of therapeutic milk, we need 2 scoops of F75 powder. Take the scoop and gently fill it with powder. Do not press on the side of the can as the scoop will become too tightly packed. Using the rim of the can or flat edge of a spoon or a knife, level off the excess powder. Adding more or less powder than instructed could make children ill. Make sure the scoop does not come into contact with water or moisture while you are preparing the milk. Replace the scoop back into the can. Ensure the can is then properly closed. Mix the powder and the water thoroughly by stirring it with a cleaned and sterilised spoon. Be careful to avoid scalds. Now the feed is prepared, it must be cooled down quickly to feeding temperature. If you are using a bowl with some cold water to cool the feed, fill the bowl with a small amount of cold water so that the cup can sit flat in the bowl. Ensure the prepared feed does not come into contact with the water in the water bath. An important safety step after the feed is prepared is to ensure that it is consumed within 2 hours. Made up feed of F75 and F100 that has been left for longer than 2 hours is not safe for consumption by infants and children. Dry the outside of the feeding cup with a clean or disposable cloth and label the cup. Include on the label the type of feed, in this case it's F75, the infant's name or child's name, the time and the date that the feed was prepared, the volume of feed prepared, and the preparer's name or initials. Adequate labelling ensures traceability of all feeds and helps to determine when the feed needs to be thrown away. Because very hot water is used to prepare the feed, it is essential that the feeding temperature is checked before giving it to the child to avoid scalding their mouth. Check the temperature of the feed by dropping a small amount of the feed to the wrist. If it's room temperature, then it's ready to give to the child. Sometimes it's necessary to prepare feeds for many infants in hospital wards or feeding centres for children with severe acute malnutrition. This requires mixing batches of feeds in large containers and then transferring them into individual feeding cups. Therapeutic feeds prepared in large open containers are more susceptible to contamination. Also, large volumes of feed take much longer to cool down, and this creates conditions for harmful bacteria to grow. To reduce the risks, the hot batch of therapeutic milk should be poured into serving cups immediately. These smaller quantities will cool down faster than the big batch. Today we will be making up 2.4 litres of F75 milk using 2.2 litres of water and a whole can of F75 powder. To make up the whole can of F100, you will need to add 1.8 litres of water, which will then make up 2.16 litres of F100 milk. Boil a sufficient volume of clean water in a large pan. While the water is boiling, write out the labels needed for each feed, including the name of the child, date, time, volume of feed and initials of the preparer. Pour the appropriate amount of boiled water, which has been allowed to cool slightly, but not below 70 degrees, into a cleaned and sterilised measuring jug. In this case, we need 2.2 litres of hot water. The temperature of the water should be checked using a sterile thermometer. Empty the whole can of 400 grams of F75 powder into the jug containing 2.2 litres of hot water. Stir the mixture immediately using a cleaned and sterilised spoon or whisk. Ensure that it is mixed evenly. Once the powder is blended with the water, immediately pour the feed into individual feeding cups, taking care to avoid scalds. Check the made up F75 milk to see if it has reached feeding temperature before giving it to the child. The feed must be consumed within 2 hours. Made up F75 and F100 that has been left longer than 2 hours is dangerous for children and must be thrown away. Preparation of F100 is done in the same way as it is for F75. You wash and sterilise the equipment, then read the label of the F100 can for the correct water and powder to add. And then we use hot water that is not less than 70 degrees Celsius. And then feed the child once the prepared milk is cooled down.